just like to thank everyone for joining us. My name is Ian Chalmers. I'm the founder of DesignMeets and Pivot Design Group, and we're located in Toronto. This is our first virtual event since 2010. We've had over 30 plus events in person in different towns and different cities in Ontario and Quebec. And this is definitely something new for us. The Zoom calls are definitely nothing new for any of us, but this is officially our first event since the pandemic unfolded about a year ago. DesignMeets is a social gathering event, community event, where the idea is to get together, exchange, inspire, collaborate in meaningful ways so that we can utilize design and its power to transform ideas. Way back on February 23rd, 2020, seems like a long time ago, we met for a DesignMeets Climate Action event on a very cold and snowy February night at Sidewalk Labs in Toronto. And I'm going to assume a few of you, I know our panelists were there for that. And it was a very good event. Our theme was about climate, about a changed climate, and about climate action. And it was around the idea of, now that it's changed, what must our design do to change? Some of us back in February had little idea of what was around the corner for everyone, for the planet. We had a global pandemic unfolding. We had social and political unrest in the US. We had a heightened level of unpredictability. We had a change in how we lived and how we worked. And we had an increase in stress and anxiety. Our climate was still in change, but our appetite to focus on it at that time was temporarily put on pause. We have a little short video we just want to play, which is a summary of that event. Tonight, we're going to hear from some wonderful people here in the front row who are going to talk about ways that they influence change. It's amazing what small change can do. So we're going to talk about sustainability, clean tech, zero waste, built environments, entrepreneurial activities, reduction, reuse, and recycling.
Thank you very much. This is a daunting task.
Learning in an entirely new way, learning to live with nature in mind all the time.
The clean tech industry will be a $2.2 trillion market in the next couple of years.
We really do need to design as if we are in a climate crisis. And in my line of work, that means that we need to ambitiously pursue models of care and create health services where patients can live healthy lives within their communities.
If we look forward to 2040, we have a lot less heating degree days. It's going to be a lot less cold in Toronto.
We must cut carbon out of construction right now.
The main problem is our human system, or economic system in which we have.
Thank you to our speakers. Thank you to everyone that's here tonight. So thank you, everyone. Just give a round of applause. As you can see, it was a great event, lots of energy. Unfortunately, Sidewalk Labs is no longer here. They had a very good space for hosting those types of events. Fast forward to 2021, what a difference a year makes. Today, we're still asking the same questions. Our climate has changed, so must our design. As humans go, we're pretty adaptable though. Our time to make things right is definitely running out. As designers, as creatives, as entrepreneurs, design thinkers, doers, we have a role to play and we need to take action. In today's event, we're very grateful to have our 4 speakers from last year's in-person event. So I'd like to welcome our panelists with a short introduction about their bio. Paul Dowsett, welcome. Paul is the founder and principal architect at Sustainable. He believes designers should use materials more responsibly so that we don't increase greenhouse gas emissions. Welcome, Victoria Haldane. Victoria is working on her PhD at the Institute of Health Policy, Management and Evaluation at the University of Toronto. Her work centers on applying health services research with design thinking, with the aim of creating more person-centered health systems which are environmentally sustainable. Tina Saltveri is an environmental educator, an activist, and founder of Ronsi Reduces, a grassroots initiative launched in January 2019. The idea is to engage local businesses and residents to reduce single-use plastics and packaging by practicing waste reduction together. Key word here is together. Tina's group was actually just featured on CBC radio just a couple of days ago. Hélène Saint-Jacques, a leading researcher in sustainability and resilience. Her work includes the renewal of local and healthy food systems, solid waste diversion, food waste reduction, water conservation, energy conservation, and renewable energy. Hélène, that's a very tall order. Our speakers will have about 5 minutes and 5 slides. That's typically what we do. In this case, we're not doing the speaker event in person with the 5 minutes, 5 slides, but we'll try to contain some of the conversations around 5 minutes. We're going to make this more like a fireside chat and talk about where we were and where we are today in relation to climate action. There will be a chance to ask a few questions should they come up, and you can do that. There's a Q&A in the webinar in the navigation. So please enjoy your lunch, your tea, your coffee, your water, and let's get into it. So Paul, we're going to start with you. Paul's wearing a very appropriate color today. In our last event, you spoke about construction and its over-reliance on cement, which is responsible for massive amounts of carbon emissions. You said this is something that absolutely has to change. You talked about adaptive reuse, green projects, carbon's removal from the atmosphere, and really challenging the industry to reduce carbon output to zero in a decade or in the next few decades. Can you bring us up to date, Paul, where we are today from where we were yesterday?
Certainly, Ian. Thank you. Thank you so much. And to the audience, who I can't see in this format, so it's a little odd, but to the audience, welcome. What's changed is kind of the question there. What's changed since a year ago? Not very much in the construction industry. We still see a lot of buildings going up using a tremendous amount of concrete and steel. And those are very carbon intensive materials. And by carbon intensive, we mean that the processing of those materials, the creating of those materials puts a lot of carbon into the atmosphere. So I just want to share a slide to talk about what this carbon cycle is. So on the left-hand side of the screen, we see a little building. And the combustion of fuels, the combustion of fossil fuels, coal, oil, natural gas, wood even, any of that is putting carbon into the atmosphere. And the carbon cycle works by the plants, trees, etc., through a process called photosynthesis. The trees and other plants, anything green pretty much, brings that carbon back down and then deposits that carbon into the ground. Animals eat those plants, their waste puts more carbon into the ground, and that's what the cycle is. And we as humans have upset that cycle because we have started, through our buildings and through our ways of interacting with the environment, we've started putting way too much carbon into the atmosphere, such that the plants and the other things that we have, the plants that are trying to draw it down can't draw it down fast enough. And that's creating the greenhouse gas effect. So from my industry, the construction industry, we really have to stop using concrete and steel. And an option for that, I'm going to play you guys a short video, and we'll see what
Everybody
the option
knows
is.
that wooden houses are for children, doggies, and weirdos who live in the backwoods. Yes, they have seen the light. And now also modern intelligent people realize wood is the world's best building material. Soon we will have wooden bridges, arenas, houses, kindergartens, and even skyscrapers all over. You're gonna love it. So, has wood come into fashion? Since when did it ever fall out of fashion? It's always been the best building material, whichever way you look at it. Now get your brain around this. Relative to its weight, wood is the world's strongest building material. That's the way nature made it, which is why building with wood is quick, easy, and economical. As all do-it-yourself women know, it's a piece of cake. And because nature made wood so strong and flexible, tall wooden buildings remain standing even during earthquakes. Now here's something for your heart. Wood is beautiful, feels good, and has a wonderful scent. Creates an excellent indoor climate and acoustics, and keeps you warm. But don't take our word for it. If you would, give it a try. Here's something for your conscience. Wood is the most environmentally friendly material. It's the only building material made by the sun and with carbon from the air. So wood stores carbon and reduces the greenhouse effect. And it's the only renewable material in perpetual supply forever and ever, from properly managed forests, of course. And should wooden houses be demolished, you don't end up with waste. No, for wood can be recycled or burned, thus using the solar energy stored in the wood to replace using coal, oil, and gas. Brilliant! Which is why modern intelligent people choose wood, caring for themselves as well as for future generations. So build a better world with wood, for wood is good.
So that's essentially where I'm going with my work from this point forward. Well, really from a year ago forward, moving completely into constructing with wood, because I think that is the answer that is going to get us, out of this climate crisis that we're in. As I said, very simply put, we have to stop putting so much carbon into the atmosphere and start drawing it down. And wood construction is the way. So thank you.
Thank you, Paul. There'll be more. I see some questions already being posted for you, so we'll come back to those later, but thank you for that. And you actually stuck to that format, Paul. I'm amazed. I guess it's practice from last year.
Yeah.
All right, Victoria, you're next. Victoria's Paul's talked about the built environment and construction and architecture. Victoria, being in healthcare, will have a lot to say today. So Victoria, my question in a recap of where we were last year. With the pandemic, healthcare has been pushed to its limits and experienced unfounded transformation. What have you seen? What have you experienced over the last year in relation to healthcare and sustainability?
Absolutely. Well, thank you for having me back. And I'm excited to share with you a little bit, because it's wild to think that just less than 2 weeks after our last Design Meets, COVID-19 was declared a pandemic. And of course, between now and then, you've all gotten a crash course in epidemiology just by existing at this moment in time. And last time we met, I shared a story about how my first aha moment between climate change and health happened when I was a teenager during a massive wildfire in my hometown. And how experiencing that really hit home for me that this was a crisis, and that, my hometown could catch on fire, and not just one year, but every year. And I think in the past year, we've probably all had moments where crisis has hit home. And I really just, as the healthcare person on the panel, I want to hold space for and acknowledge that this has been a hard year. And not only because you've all become epidemiologists overnight, but joking aside, it's really hard to talk about the climate crisis when we're living in a pandemic. And yet living in a pandemic is also a very good reason to talk about a climate crisis. So now that public health has become very visible, it's on the news, it's around our dinner tables, it's everywhere. In a lot of ways, so too has the carbon footprint of healthcare. So pre-pandemic, if the healthcare sector was a country, it would have been the 5th biggest polluter globally. And certainly our carbon footprint has likely increased. So one group of researchers estimated that in the first 6 months of the pandemic, over 150,000 tons of carbon dioxide was emitted from personal protective equipment use in the UK alone. And of course, people immediately think of disposable masks and gloves when we think of waste in healthcare. But really, the carbon footprint of care during the pandemic has been so much more than that. When we hear on the news about totally full intensive care units and overflowing hospitals, often what we don't think about is that these require massive amounts of necessary plastics, disposable personal protective equipment, and energy to provide high quality care while also keeping our healthcare workers and other patients safe. And hospitals, even before the pandemic, were really carbon intensive places, and hospitals at full capacity are obviously even more so. And while there's truly really admirable work being done under some extreme conditions, as you can imagine, to mitigate the waste in hospitals while maintaining safety and quality and responding to a pandemic, my real interest is about thinking upstream towards prevention and how do we transform systems to keep people out of these carbon intensive hospitals in the first place. So in the past year, we've all seen that public health is about prevention. We live it every day. We wear masks, we wash our hands, keep physical distance. And in preventing ourselves from being infected with COVID-19, we prevent others from being infected. So we break those chains of transmission, and as everyone's heard, we help to flatten the curve. So we do our best to keep ourselves and each other from requiring this carbon intensive care. But we've also seen how the systems that we're a part of, it really makes this hard. Like, how do you maintain distance in a crowded workplace like a meatpacking plant? Or how do you stay home when you've been deemed an essential worker and you need to commute on a crowded bus? And of course, how to quarantine for 14 days without paid sick leave. But these all represent opportunities for infection and for more people to end up needing intensive care. So obviously our policies need to change so people can practice prevention and we can keep folks out of hospital and reduce this need for carbon intensive care. And then as we keep pushing for these policy changes and individually doing our best to follow public health advice, we've really already seen some super positive public health changes in the past year that are really encouraging. So the massive jump to telehealth, it's a really great example of rapid change that before the pandemic was really thought to be impossible. And while hospitals are carbon intensive, the total carbon footprint of the health system also includes things such as the carbon emitted when a patient drives to see their doctor. So telehealth is a great opportunity to reduce emissions, even more so if we can keep pushing for greater accessibility and equity so more people in more places can equally access this care. And here's where we absolutely need design. We need to really create online spaces for care that everyone can use and that are integrated into the wider health and social care systems. So this is my call out to user experience designers in the health space. We've also seen bike lanes pop up, and when the lakeshore was shut down for cyclists and joggers, these are really excellent ways to reclaim the city towards public health and to forefront prevention activities for cardiovascular diseases. And it really shows how urban planning is so closely tied with health. And to do a bit of foreshadowing of Lynn's presentation, more people are growing backyard and patio gardens and being really mindful of what they eat and where it comes from. And that makes public health people like me very happy as well. So there's also been a lot of discussion and awareness of mental health and our connectivity with nature, including the rise of nature prescribing and our universal reliance on our little afternoon walks. So these are some really hopeful opportunities and pro-public health changes that could potentially create healthier conditions within our communities that will persist beyond the pandemic. And these are the conditions that keep people from ever needing the carbon-intensive care in the first place. So I think to sum up, while it's been like a really sobering and stressful year, there's definitely toeholds towards a health system that cares for people and the planet. And I think within the health sector, there has been a greater recognition that we all have a role to play and that really we need to act to protect and preserve our planet, because truly a complete and healthy biosphere is the best prevention that we have against future pandemics.
Wow, fantastic. Thanks, Victoria. It just comes so natural to you. That's awesome. And we will come back to that if anyone has any questions related to healthcare and to what Victoria had just covered. Over to Tina. And now we've talked about built environment, we've talked about healthcare, we've talked, and one of the areas that's very important and close to my heart too is plastics and packaging and reusable containers. So Tina, the Ronci Reduces was a grassroots initiative. It had a huge groundswell effect in adoption through the community by reducing single-use plastics and packaging, and ultimately by practicing community collective waste reduction. Then the pandemic happened. Where is the movement today?
Yes, hello everybody. Thank you for having me. It's a very good question. And I would like to share some visuals with you too. So I start to share my screen. And here we go. Okay, here we are. So I want to welcome you all from Roncesvalles, a neighborhood next to Hyde Park. And this is what we see right here. It's Hyde Park. It's amazing. Yeah, I took this picture only like 2 weeks or 3 weeks ago. And it shows something that Victoria was talking about the good outcomes that we had from this very harsh year that they are there, because people started going out. They started to connect with nature, and the more we all connect with nature, the more care we care about it. And there's actually more. We were suddenly able to drop down our CO2 emissions, and we were able to give wildlife a new chance to come out and a lot more space without all that traffic. But at the same time, this crisis, this pandemic, has led to a huge increase in plastic waste. And I see it actually in my own blue bin this morning. And it bugs me a lot. I have a lot more plastic. So the single-use plastic has increased 250 to 300% during the pandemic. And this is not only because of PPE, but also because of the understandable fear initially that reusing anything, whether it's shopping bags or containers or anything, could transmit the virus. And this has led to a ban or avoidance of reusable shopping bags, produce bags, coffee cups, anything in many places. And yeah, suddenly I accumulate all sorts of plastic because I couldn't use my reusable bags and containers anymore. But in summer 2020, last year, over 100 international scientists and health experts and the Canadian Association of Physicians for the Environment released official statements about the safety of reusables during COVID-19. So they explained that the virus spreads from person to person through droplets, and surface contamination in grocery stores and restaurants are not an issue. Reusing and BYO, bring your own, is actually safe. Toronto Public Health allows it. And no matter what the pandemic is doing, single-use plastics remain a tremendous threat to the planet, and it will stay that way until we resolve it. So what needs to be done? We need to go circular. We need to make every effort on every level to become a circular economy. And the truth is, there are steps already being taken. Many people understand this. The federal plastic ban is coming, and we can all welcome it and put it into practice. A recent poll has actually shown that the majority of Canadians want the government to expand the list of banned items. And this is exciting too. Here in Ontario, Loblaws has partnered with Loop to offer zero waste groceries in returnable containers. And we already heard from users that Loblaws is running out of products because the uptake is so great. People are totally ready for it. So here we are, Roncesvalles in our neighborhood. Right here, we're doing a neighborhood and shoreline cleanup to reduce plastic waste and litter going into Lake Ontario, and also as an outreach to our community. So we still try to lower barriers for reuse and change habits. We have been revisiting businesses in our neighborhood, spread the word that BYO is safe, and promote those that allow reusables. We've also partnered with Runcie Pickup. This is a local dinner takeout business, and together we offer their food in deposit return containers. We actually created this little logo for them. We support other startups that offer new ways of doing takeout, such as Inwit. It's about to launch. It's a reusable container app for restaurants and to offer reusable containers. And Dream Zero has also started a deposit and return coffee cup that's coming now this week or next week actually to Roncesvalles for coffee shops, and the cup is called Muse. So if you like takeout food and takeout coffee, look for them and support them so they can grow. Right now, what we're also doing is we are collaborating with Parc des High Park for Climate Action on a town hall with Gord Perks, with our city councillor, about plastic waste reduction in Toronto. This is supposed to be coming soon. And also, we work with other Reduces groups and are currently building a Canada Reduces website, which is very exciting. And it's supposed to launch on the first day of spring, actually. So thank you, everybody. And I will stop my share.
Thanks, Tina. For those that might not be aware, maybe you don't live in Roncy, this groundswell, this kind of community organization is happening in two neighborhoods one that I live in and one that I work in, St. Lawrence, St. Clair. So if you look around, you'd be surprised to find that there is an organization that's doing Reduces, and you can volunteer, you can do whatever needs to happen. And if you're interested, please connect with Tina. She can connect you with your neighborhood and contacts there to volunteer.
Yes, thank you. Thanks, you, Ian.
Tina. Thank you. All right, Ellen, we're going to talk about food and waste, another popular topic for sure. So Ellen, you worked on Toronto's Blue Box Revolution. You helped to shape public awareness around recycling. You spoke of food waste. You talked about the need to transform its processing into a more circular system, and that would translate into zero waste. How do we move forward on these initiatives? Over to you.
Oh, I'm so glad you asked.
Oh, good.
What's been happening in the last year, and we're still in it. It's an experiment in motion. And with food waste, it's food. So when the pandemic struck, people went to ground. They went shopping, they stocked up, and they went back to the kitchen. Perhaps some were cooking in the past, but there was a whole refocus. Suddenly food became the central core. The issue. Lots of stress on the food system, but essentially it was able to deliver. There was some broken supply chains that developed very quickly. But what we have been testing for years is this food waste, and how do we stop it? And what are the root causes? And there are many, many, complex. But one of them is the issue of skill. Because in order to use everything up, including, I'll talk about radical stuff like carrot tops. Well, actually, you can make pesto out of it. But people now were at home and they had time to go to the kitchen and to start cooking and to do some pretty crazy things and I love cooking, is even to make sourdough bread. But one of the things that we realized was the lack of time and skill perhaps were a major contributor. That's one of the variables, or two of the variables. But another one that we tested out actually in some research with shoppers at farmers markets in the Golden Horseshoe was that people who were buying direct from producers, direct from farmers, there's very much an emotional link there. Granted, probably the item is a bit more expensive, possibly, than what they were getting at a supermarket. But that emotional connection with the grower, the end product was, people think, or they were saying they were doing this, is using, those tomatoes became very important. You don't ignore them. You don't ignore those potatoes, those vital things that you bought at the market that you place high value in. And what we hope it appears to be more connection with food, and therefore the desire to make it and to eat it. And we see in the data that more people are eating leftovers. The issue came up prior to the pandemic is, how do I use leftovers? What do you do with them? Well, now people are at home and they make sandwiches out of things, and lots of opportunity. And the other lovely connector with this, to really animate people's relationship with food, was people wanted to grow things, even if it was a pot of herbs on a window ledge or a balcony. Community gardens exploded. Try and buy seeds. Seedy Saturday, last Saturday, very popular. Well, they had to do it virtually and the website crashed several times. So there has been an outpouring of interest and learning happening around food. And the data isn't in yet, but because these things tend to be done biannually, the waste audit, we suspect that there's less food waste. There certainly has been more income flowing to local farmers. People showed their love and they connected both delivery services and online purchasing, which were virtually non-existent in that direct to consumer relationship. Now, there are new links and new ways of making us all live together in a more sustainable way and to place more value, to repatriate the food system. That's what we're trying to do here, and be healthier. Because something like 28% of Canadians are eating the required up to 5 fruit and vegetable portions a day. We're very low on that. So the data is being tracked in terms of what we're eating and whether we're eating more produce, these healthy items. So it's looking pretty good. So if I run out of my time, I tend to overrun.
That's good. That's great.
Good.
We can keep going here. We've still got some time, but
okay, can I make it?
You can.
I just wanted to make one comment. It seems that there is reduction of packaging. We know that, and what Tina and Victoria are referring to is there really is a lot of waste in these systems, carrying things, just packaging. And it's being dealt with very cleverly by a lot of the local producers, and people are very happy to, you can bring your own bags to farmers markets. Things are operating in a completely different way, and there's a judicious concern about the use of plastics and one-time packaging. So thank you.
Absolutely. No, thank you. That's great. It's something that is very topical, of course, as we are all, working from home, living from home. We're consuming differently. We're recycling differently. We're trying our best, and it's definitely been a challenging year for everyone. So we had a few questions posted, and some of them were answered. But there was one I was going to mention to Victoria that's kind of interesting. So Jingtae has posted for you. How do you think UX designers can help in contributing to better sustainability practices? So this is a great topic. And for those of you that don't know what a UX designer is, it's a user experience designer, somebody that works on, it could be digital, it could be experiential, but they think about people and they put patients or users at the center of their thinking. So over to you, Victoria, on that.
Yeah, it's a great question. And I'm really glad it was posed because as a former digital UX designer and now healthcare person, I see the two worlds collide all the time. And I really think that especially within the healthcare system, there's a few different ways. We do need to start redesigning our hospitals and clinics and way care is delivered. And I think we talk a lot in healthcare about people-centeredness, but I really think the unique skills that UX designers bring to the table in thinking through the person experience, going on these user journeys is super beneficial in redesigning these spaces and these processes. And also the skill set of doing the user experience research, talking to people, bringing together a lot of the different threads and disparate ideas that need to be brought together will be super important in future. And I know it seems really minute, but I think as a UX designer, as someone working on a design team, designing the most user-friendly things you can that patients want to use that will keep them out of hospitals, help them manage their care better, you're really contributing to sustainability within the healthcare system. So it sounds very like 3 levels removed, but I think sometimes we do need to think 3 levels removed, that by embedding quality in whatever process that you're doing and thinking of that bigger prevention picture can really help in pushing this agenda forward. And I think it takes all of us to sit and have a look at our skills and see what we can bring to the table. So
Great answer.
there's a quick answer.
Absolutely. And hopefully that's satisfactory. If anyone has any other questions, feel free to post them in here. You know, for the speakers, we said when we get into this, we would keep it very conversational, because that's the great thing about this space is it doesn't have to be overly thought, and I think conversations are important, especially in this space. But Paul, we talked some time ago about, you know, micro and macro, and Tina, you can see this in Lan and Victoria, but there are things that we can do on a small level, right? It doesn't feel like we're making much change, but if enough of us do that, it will have a change. What are your thoughts, and feel free, anyone that wants to speak up on that, about the daunting, scary macro versus something that's maybe close to us on the street in a micro sense?
Thanks, Ian. I'll take a first stab at that. So, you know, you're absolutely right. When I listen to the great presentations from Victoria and Tina and Elaine, they're generally talking about things that affect all of us daily. I mean, a year ago, we didn't think of our health quite as much as we do today. So, but it's definitely top of mind nowadays. And you know, we're consuming things, we're buying things with packaging, we are eating things every day. So those are all everyday experiences. Very few people have everyday experiences with the construction industry. So in some ways, that might be more of the macro scale. And we as individuals don't think we can do very much to affect that. But I think that, and I think this pandemic has helped, I think people are now getting much more conscious of the spaces that they live and in some cases used to work in. And they're thinking critically about them. And I think if people are able to translate their thoughts about health and packaging and food and translate that thinking to their buildings as a big package that they live and work in, and what do you want that package to be? Do you want that package to be made out of materials which are both unhealthy for the occupant and unhealthy for the planet? Or do you want that package to be made out of materials that are healthy for both? I think that's rather a rhetorical question. I think the answer is obvious. And yes, it can be done, and we just have to start demanding it. So thank you for that.
We had a question for Alan. Kelly posted a question in the chat that reads, I was surprised to read this morning in The Economist that global carbon emissions for 2020 are up. I believe this is from consumer use. So there's one for Paul here. So we'll start with Alan. It says, Paul, is this from buildings, ? And then Alan, consumers have a high energy waste from washing too. So what do you think about this, where this all comes from?
I'm really curious. You've got me thinking there. certainly there was a lot of speculation around energy use, and yeah, people were not driving as much, but they will. They can hardly wait. And in fact, I was reading Qantas Airlines in Australia now have mystery trips, and you can just get in a plane for $750 US and fly around for a day. What consumers, I can't think, unless they're buying like crazy, which they may be. There's a lot of online shopping going on.
I think, Paul, you might have a response to that too, and I think that we may know why, because there's definitely things are still happening. All they're not supposed to be happening.
Yeah, the buildings' contribution to our carbon emissions hasn't gone down because of the pandemic. Office buildings are still operating. They didn't shut them off, even though people haven't been in them for almost a year. They haven't turned them off. They still function. They still heat and cool the buildings. And my observation in the past year is that everybody I've spoken to anywhere in the world, the construction industry has been deemed an essential service almost everywhere. And construction has been carrying on like crazy. And so we're producing, again, so much more concrete and steel during this pandemic that those production processes are what's putting the carbon into the atmosphere even before the building starts operating. And so I think that all of those are contributing to this global rise in carbon emissions. When you look at what has happened, we've seen it really increase in the last 150 years since the start of the Industrial Revolution. And then the last 50 years, or slightly more, since the end of the Second World War, that's when the hockey stick started, when it started its steep ascent. And when you look at even the last 5 years, and in 5 years, we as humans have definitely known that carbon emissions are the issue. We know that we cause them. Like anybody who does not say that, who does not understand that, is simply lying. They're lying to themselves mostly. We all understand this. And yet in the last 5 years, that graph has gotten steeper. So although we know we haven't done anything about curbing it, to tie it back to the pandemic, we're less than 14 days away from our first anniversary of 14 days to flatten the curve. So Victoria, how are we doing at flattening that curve?
Room for improvement.
And exactly the same with flattening this curve of carbon emissions.
I was going to say that's going to be the next curve, and hopefully there's an appetite to tackle that. We have Kelly, by the way, had posted that the data came from the International Energy Agency. That's where that increase in CO2 came from. So there's a couple of interesting questions in here. Question about the Green New Deal, and if Canada were to implement this type of economy, could it be integrated into a federally funded partnership with your initiatives? Does anyone have any perspective on that? Might not have had time to kind of think about it, but in the context of your areas of expertise, and that's okay.
I feel a little bit like I'm monopolizing here, so my apologies to Victoria, Elaine, and Tina. But yeah, in my industry, the construction industry, the Green New Deal is exactly what is needed. There needs to be an absolute mandate from the highest level that simply, this is what we must do, and we are going to mobilize against this as though we were mobilizing against World War III. Like we are just going to marshal all of our resources and focus, for the next decade or whatever it takes, we are going to focus on one mission. And that is going to be to bring down carbon emissions and really stop that ridiculous process. So I think we need the Green New Deal, and Seth Klein has come out with a book called A Good War, and basically he is talking about how we need to approach the climate crisis as though it is a war.
I have another question for all panelists here that's of great interest. So it's about skills and access to knowledge and why they're important. So like many Torontonians, Ontarians, and people living in Canada, people living in poverty in particular, in this person's experience, they can be ahead of us more privileged folks who can purchase as well as we wish in growing the community gardens, etc. And they form a huge and growing portion of our population. It would be great to include some of these grassroots leaders in our conversations with a nod to the people of Roncy. How might we do this? Any comments on that? So
yes,
that's from Gillian.
I'm involved in that with Food Share and other organizations, really lobbying the City of Toronto to access more of our public lands for exactly that purpose, for community gardens. There's a huge lineup, hundreds of people. The skills are there in the community. The seeds are to be shared. I mean, the only thing that's missing is the land to do that in.
Mm-hmm.
Absolutely.
But it's a team.
Lobbying. I think we need to lobby.
And I think, Tina, you were addressing that question just because being a grassroots organization, you're enabling and engaging people from anywhere in the community to participate.
Yes, I think that the learning together is the key piece, and it comes from different levels and different groups in the society, and we should become more or less segmented, right? And it's actually a challenge, because in a way you live in your neighborhood and do things in your neighborhood, and it's easy to get lost inside, and it's important to look outside too. And Roncesvalles is a good example because it borders right on Parkdale, right? So Parkdale is entirely different, and so we in our group have talked about it, that we want to reach out to Parkdale, and we have started. There's a few people who are interested to create a Parkdale Reduces, and it would be a different group, right? But it would be important for us to have a way to start connecting. I mean, it was a little bit paused, that idea, because of the pandemic, because the way we set it up is we started going to the businesses and talk to them. And if you start that anew during the pandemic, it's much harder, right? It's harder to start a new thing where reservations are really high against changing habits for restaurants, for example. So restaurants feel like we have enough on our plate. We barely survive. Many of us have closed. I can talk to you about plastic right now, right? But it is our plan, and it's very important. And it's a really good concern. It's very valuable.
Excellent.
Can I just jump in really quickly from
Please,
the health perspective? Yeah. So when I think something that I think needs to be more done in the health sector is partnership with our local Indigenous communities, because I think a lot of the things that we aim for, or when we're talking about these community-centered models of care, caring in the community, intergenerational care, a lot of these things we're aiming for the ideas have been around for millennia. And so I know in at least my work, I seek mentorship from Indigenous scholars, incorporate Indigenous ways of thinking, because the answers have already been there. And we just need to, in many ways, open our minds and open the conversations to others and respect other people's knowledge and hold it as equal to our own. So I think in the healthcare sector, though, there's still a lot more opportunity to push ourselves to engage further, and not just with Indigenous communities, but with all communities across Toronto and everywhere. And then just really quickly to the Green New Deal, super quick. I always like to think about the NHS in the UK. So they put this big all NHS thrust towards, we're going to be a net zero health system by like 2060 or something like that. And it's everyone focused on this same goal. Now, in Canada, our health system is a little bit different. It's not national. We are federated, so every province is kind of doing its own thing. But we really do need to start to work together and have that common goal. And you see the beginnings of it happening in people connecting across the provinces and having conversations and mobilizing towards these big goals that other places are doing. I mean, if the NHS can do it and set up goals and indicators and really put that as a priority, so too should we. So I think the gauntlet has really been thrown down. And at least in my work, I always try and say that, you know, we're behind the curve. Like, we have catch up to do in so many areas, and the health sector is not at all exempt from that. And I think the pandemic has put a lot of strain on the health sector, but the health sector is going to have to keep meeting the demands of the climate crisis, because every climate crisis is going to end up you're going to end up in emergency rooms. There's going to be heat waves, spreads of infectious diseases. It all comes back to that. So I think we really need to take it upon ourselves to meet the challenge. So anyway, there you go.
Fantastic. That's a great addition. And as we're nearing the end of our session, it's 12:54. I thought maybe we could, although I was laughing, there was a comment about Paul's lovely wine glass holder, or your holder in lovely wine glasses. Please contact Paul. He'll put you in contact with his provider of wine glasses.
Everything is for sale.
This is the benefit of doing it at home, right? We get to see each other's lives. I thought I'd just quickly, maybe each of the panelists could just summarize in a minute, you know, an important takeaway for anyone here that's watching today. Is there something that you would depart in a very short period of time? Paul, did you want to start?
Sure, absolutely. Thanks, Ian. One parting thought is everything I've spoken about today is primarily focusing on new construction. And we are not going to get ourselves out of this problem of buildings spewing carbon into the atmosphere if we only look at new buildings. New buildings account for 2% of sort of the building stock that we have. So we really need to look back at the existing building stock, the other 98%, and we need to reduce the operational carbon emissions of those. We can't do much about the embodied carbon that's in the materials of the buildings anymore, but we can respect that. We can adaptively reuse those buildings. We can retrofit them to be more energy efficient so that we can get them off fossil fuels, and we can get them to clean electric energy only. And we have to pay a lot of attention to the materials and methods we use for those retrofits so that we're not using more concrete, more steel, petrochemical laden insulations like foams. We got to get rid of all the plastic, all the petrochemical materials and methods in our buildings, both with retrofits and with new builds. So that's my parting thought. Thanks, Ian.
Perfect.
Thanks to the rest of the panel too. Great to see y'all again.
Who would like to do a little summary? What a departing gift for the audience? Tina.
Yes, I want to come back to the positive learning in the pandemic, and that it shows that we can actually maneuver in certain ways in unexpected ways out of situations, and that we can bring down the CO2 emissions and the traffic in the air, and that a lot of learning has been happening during the pandemic. There are so many webinars, there's so many learning spread and exchange. It has opened up a lot of questions. So I feel I feel positive about the openness and learning that has happened during the pandemic, and I hope that continues to happen.
Excellent, great point. Thank you, Tina. Two more, Hélène, and then Victoria.
Yes, thank you. Can I build at Victoria? Excellent points. I'd like to build on that. What we've learned, and not just in the baking, but in the appreciating, the sharing of food, and perhaps even growing some food. And I think going outside is a very healthy thing. But next time you go out, start trying to connect with your community. There is so much happening at the grassroots levels in very, very exciting ways. In Victoria, you mentioned Indigenous communities, but also communities of color. There's tremendous food, culture, and learning in the city of Toronto, and people are so keen to share these things. So look and get involved. It's lots of fun. You've got nothing to lose. And thank you, Ian.
Oh, of course. Thank you. Thank you.
Love it.
Victoria, I know you've said so much
Alright.
already, but you know, come on.
It's been a full hour. It's been a full hour since any of you have gotten a public health directive. So here I am. To sum up, keep wearing your masks, keep washing your hands, hang in there a little bit longer on the physical distancing, say yes to your vaccine when the time comes, and really keep working every day to build a healthier community, because we all have the power to do it. It speaks to Elaine and Tina and what the other panelists have said. We all have our own ways of working at this massive crisis, and it's going to take all of us putting in our best effort to, you know, see the future that we all want to see. So well done, everyone, for surviving thus far in a pandemic and under these conditions. You're all superstars.
Thank you, Victoria. That's great. I'll just do a quick wrap up. I'd like to thank our speakers, Paul, Victoria, Tina, Elaine. Thank you for your time today. It's a big deal, and we appreciate it and your thoughtful ideas. Thank you to Lauren and Tori in the background. They're helping manage this webinar. Thank you. Please feel free to reach out to us at any time. And remember, and to our audience, thank you for joining us today. We really appreciate it. And remember, through any small acts that, you know, day to day, with a goal to affect change, and, you know, as we've talked about our community, we can have an impact. So let's move forward with this motivation that we have from our conversation today. I think there's a lot that can be done. So, and I'm an optimist, so that's what I always try to spin things in a positive. That's the way I feel, and I got that from the group today. So thank you, everyone. Have a great day, everyone. Enjoy the rest of the week. Thanks all.